So the reason I'm excited is the trends and the buzzwords that I'm starting to see cropping up a lot, not only in social media, but on like the healthcare email alerts from the various like American Medical Association, American Academy of Pediatrics, and what's going on even at the policy level. We're starting to see all of these buzzwords. I mean, you may have heard of things like digital detox and dopamine fasting. You know, these are things that are becoming more common. Okay, this is episode, what? Is it 37 already? Wow, episode 37. Welcome to the Eat Your Greens with Dr. Black podcast. If this is your first time listening to the show, I'd like to welcome you. I'm Dr. Black. I'm a board-certified pediatrician, and I have a strong drive to help my patients, their families, and you, my listener, take control of your health, have more energy, and a lower risk for all of those chronic diseases that are on the rise, even in kids. On this podcast, I mostly do this by helping you understand what the science says are the best healthy habits that will promote not only your lifespan, but your health span. Because let's face it, who wants to live a long life if you're sick, if you're incapacitated, if you can't do all of the things that you want to do? So we want not only a long lifespan, but also a long health span. In particular, my goal is to help you harness the power of a healthy, plant-forward diet in addition to other healthy habits so that you can live the healthiest, longest life possible. I'm right at the 1-year mark as a podcaster, and I have learned so much. This project started out as a resource for the parents of my patients to learn more about things like healthy nutrition and feeding so that they could boost their family's health. But in fact, I would say that I have learned as much or more than my listeners as I have interviewed experts and researched the topics for the episodes. I wanted to make sure that I was presenting all the information based on the evidence and not just my opinions or what I learned in medical school 30 years ago. So it's been an amazing journey. I'm truly loving it. My audience is growing, and I can't say enough about how thankful I am for each and every one of my listeners. I have some exciting things planned for year 2 of the show, some changes that I plan to make based not only on what I've learned about how to produce a podcast, but also as I've gained a better understanding of my target audience, that's you, and what kind of questions you all have. So, a lot to look forward to in the near future. Right now, as I am recording and publishing this episode, I am less than a week away from taking the board certification exam for the American Board of Lifestyle Medicine. As it happens, I not only have big ideas for where I want this podcast to go, but I also have some big plans for my pediatric practice. And the first step is becoming board certified as a lifestyle medicine doctor. What exactly is lifestyle medicine? Good question. For today's episode, I'm sharing a talk that I gave to a group of pre-health professional undergraduate students. I talked to them about why I went into pediatrics and also about some of the reasons that I am optimistic about the future of healthcare in our country. I introduced them to lifestyle medicine and explained what it is and why I'm on this path toward certification. It was a fun talk. I think they really enjoyed it and definitely learned something. I'm pretty sure most of them had never heard of lifestyle medicine. So I hope you enjoy hearing about why I'm so excited about the future. All right, so here we go. Here is my talk to the Texas State University Medical Explorer Group. So before I get started, I like to just get an idea of who I'm talking to. So just a vague idea of your interest, what careers you're thinking about, right? And of course, you don't have to have the answer. That's okay. But just raise your hand if you're pre-med or interested in medical school. And any pre-nursing students? Or I see one. What other fields? Just like shout them out. Who else? Some PAs. Great. Say it louder. Pre-dent. Oh, awesome. Yeah. Okay. So a good variety. I'm glad to hear it because I like to, I think what I'm going to talk about specifically, I'm not actually here to talk to you about nutrition per se. I think, you're going to get some of that in your training. Of course, it's an important topic and it's something that I'm passionate about. But what I'm going to talk about may actually be applicable to, it doesn't really matter what you're doing. So I'm a pediatrician. Like you said, I went to medical school down in San Antonio. I did my internship there. And then I did my residency training in Miami. And I started out practicing there for a few years before coming here to San Marcos. And I've been practicing in the area ever since then. And I'm going on about 25 years now in practice. So I've seen a lot of changes. Pediatrics is amazing. The kids are so cute and it's almost like being a part of the family and you get to watch them grow. And, it's really rewarding. I'm on my second generation of patients now, and I call them my grand patients. So I don't have any grandkids, but I have a lot of grand patients. So it's fun. On the flip side, though, that thing that goes around social media and they say, explain your job badly. So it is not a lie to say that I make small children cry on the daily, yay me. And there is the distinct risk on any given day that I will be peed on. It happens. But if you think about it, baby pee might be the least gross thing I get on me on the daily basis. So, everything has its ups and downs, but overall, it's a rewarding career. Sometimes when I talk to people who are interested in the medical career, they want to know why pediatrics, what made me choose pediatrics. And I think back to medical school. So, the third year of medical school is the first year in the hospital and in the clinical rotations. First 2 years are in the classroom, and then 3 and 4 in the hospital and the clinics. So at the time, I was kind of considering internal medicine. I thought cardiology was interesting, and I thought maybe that's what I wanted to do. But I was on my internal medicine rotation, and I noticed that, 80% or more of the patients in the hospital were there because of some kind of bad habit, right? Maybe it was something extreme. Maybe it was alcohol or drug dependence. But often it was, related to their diet or lack of exercise, or they were smoking. But, most of the things I was seeing could be traced back to some sort of lifestyle habit. And I thought, I'm in my early 20s. It's like, how hard is it for me to change my own habits? I know I should be eating healthier or exercising more. And it's hard enough to even convince myself to do those things. How am I going to convince this old codger? Of course, back then I thought 50s and 60s was really old. And now that I'm, in my 50s, like, no, it's not that old. But at the time I thought, no way, these people are set in their ways. I'm not really going to have much power to make a difference in their life. But then I did my pediatric rotation, and parents by and large really want to know, like, how can I help my child be healthy? How can I get them off to the best start? Doctor, what should I feed them? How do I handle this issue? And it seemed like I had more of an opportunity to make an impact. And again, the kids were cute. So I decided I'm going to go in pediatrics, and I have not regretted it. In hindsight, I, don't think I would have liked adult medicine. I think there's like two kinds of people, you either like kids or you don't. And I'm definitely I enjoy working with the kids. So it's been rewarding, but I actually am not going to try to talk you all into being pediatricians. That's not the point of my talk. Looking back over the last couple of decades in medicine, and maybe you kind of have a sense for this, maybe not. And I don't think it's just healthcare, but if you do anything long enough, sometimes people get a little jaded, right? A little cynical. Burnout is kind of a big problem in healthcare right now. Let's face it, our medical system, our healthcare system is a bit of a mess. So the other thing I'm not here to do is to say, throw in the towel and change your major to pre-law, right? This is not going to be a doom and gloom conversation, but this is the facts. Like, I'm just laying the groundwork here of what's going on. I'm actually really optimistic about some trends that we're seeing in healthcare. And I think there are some big changes coming. And what you're going to see in the next, in your education and in your careers is going to, I think, really flip how we approach healthcare in this country. I mean, not only do we have these great technologies and AI and genetics, that has changed so much in the last decade or so. Our ability to not only diagnose, but treat genetic disorders with gene therapy is really incredible. So all these like shiny, sexy innovations, that's awesome. What has me more excited is actually some more sort of mundane trends that we're seeing, some research that's growing on some maybe less sexy things. And what we're going to see is our ability to not only extend people's lifespan, but also their health span, right? We all like the idea of living longer, but nobody wants to be decrepit. You want to have your independence, your activity, your ability to go out and do things and live your life. Nobody wants to be stuck in the nursing home. If that's what living longer is, then forget it. And I think what we're seeing is some changes and some growing evidence to back up some changes. And we're going to be able to do just that. We're not only going to be able to add years to our patient's life, but life to their years with some of these things that are happening. So what I actually want to talk to you about is kind of a new specialty. By new, it's like a couple decades, but it's called lifestyle medicine. And, you may or may not have heard of this. It's a legitimate medical specialty. This is not alternative medicine. It's not functional medicine, feng shui, whatever. It's a legitimate specialty. It's recognized by the American Medical Association. You can do a residency out of medical school, and there is a board exam. I will actually be taking the board exam in December. So assuming I pass, we'll see. I will be dual board certified in pediatrics and lifestyle medicine. So it's based on these 6 pillars here, which, as you can see, like none of this seems like very shiny, new, sexy things, right? Everybody kind of knows maybe I should eat healthy, exercise, get some sleep, not do drugs. That might impact my health. But the reason this is growing is the research that we're getting now and the evidence to support how we can not only prevent, and prevention is big in pediatrics, but also manage and in many cases reverse many of the chronic diseases that are plaguing our population these days. And so that's why I'm excited. Another quick poll. Raise your hand if you are currently very concerned about your risk of dying from a heart attack. Yeah, okay, 1, the exception. Okay, right? No, nobody. But here's the thing. Half the people in this room will in fact have a heart attack, and many of us will not survive it. It is the leading cause of death across the board, and it has been for a long time, right? So maybe you should be, at least thinking about it. But so going back to that original thing I talked about, why I went into pediatrics, I'm having a little bit of a change of heart, because here's the thing. When you're young and healthy and you don't have any issues, it's hard to convince yourself, why should I change? How am I going to tell this 12-year-old, maybe you shouldn't eat pizza 3 times a week? Maybe you should consider eating something healthier. All my friends are eating it. I feel fine. What's the big deal? Even the parents, right? They're like, well, we have vegetables for dinner and we really feel like we're trying to offer the healthiest diet. And, kids should just be kids. And we live in this ultra processed society, junk food society. It's everywhere. It's hard to avoid. Maybe they're stressed and tired. They don't have time to cook a healthy meal at home. Maybe they have food insecurity. That is a huge problem now. So maybe if they could afford it, they would buy the healthy food, but they can't afford it, or they don't have transportation. And the only thing they have access to is the junk food at the convenience store because that's what they can get to by walking. So, it's a complex issue. And we just recently started a food pantry in our office so that patients, families who are struggling with food insecurity, all they have to do is tell us and they can leave with a bag of food that we get from the food bank. So we're trying to identify this address this on multiple levels, but it's a very complex issue. So now I wonder, maybe I set myself up for more of a challenge by doing pediatrics. Maybe it's harder to convince people to change their habits when they're young and healthy. And, there's something about being kind of smacked in the face with the prospect of your own mortality. We've all heard that story on the internet. Somebody had a heart attack or cancer and they turned their life around and, they started exercising and eating right. And now they're climbing mountains and running marathons. And, we all love that story. So there's something about that motivates us to change. So we'll see. Let's talk a little bit about how we currently do things here. Here's our patient. He comes into the office and he's having some symptoms. Maybe he had a stroke or dementia, or maybe it's just migraines. I don't know. he's referred to the neurologist, and the neurologist does their thing. Maybe he's got heart disease or high blood pressure. We send him to the cardiologist. Maybe it's diabetes. We send them to endocrinology, fatty liver disease. They go to GI. I mean, you get it, on and on, right? We think of all of these things as separate diseases, and our healthcare system is very siloed. It's compartmentalized. Every doctor pays attention to their one little organ, and they do their set of medications and their procedures, and it's all separate, right? But the evidence is pointing us in another direction. I recently gave another talk to a group in town, the San Marcos Lifelong Learning Group. And so this is people in their 60s and 70s, or maybe even a few 80-year-olds, not my usual audience, right? So I talked about this evidence about how, particularly nutrition, because that's my focus, can, treat these diseases and even sometimes reverse them. So I have a few slides from that. I'm not going to go into all the details about all the studies and the science. I'm just going to make a few points. So for instance, heart disease. We know that the leading driver of heart disease is high cholesterol. If you can get your cholesterol down, your chances of having heart disease or heart attack is much lower. So for instance, one study that was published pitted the most commonly used medications for cholesterol. That's statins. They are by far and away the most prescribed medication in the United States. And they pitted that against, in a randomized controlled trial, against a plant-based diet. What they found was that the people on the plant-based diet actually dropped their cholesterol by 30% in a 2-week period. And that was equal to the medication group. So you can bring your cholesterol down as much as medication with a plant-based diet. So we're starting to see a lot of this data coming out about the importance of this and how you can actually prevent these diseases. And we're learning that heart disease may actually be a foodborne illness, not just, genetics. What about diabetes? Also very common. 10 to 11% of people in the United States have type 2 diabetes. But a more impressive statistic is in adults, every 1 in every 2.5 has pre-diabetes. And many people don't even know it. And the rates of diabetes are expected to double in the next 20, 25 years. It's a big problem. And again, they pitted the plant-based diet to see its effect. And not only did they see that you can prevent type 2 diabetes from developing, but when they looked at people who already had been diagnosed, they can bring down their medication levels and in some cases actually come off of their diabetes medications. They can reverse their type 2 diabetes. So really amazing data. Let's see, what else do we have here? What about just anything? How not to die prematurely of any cause, right? This is all cause mortality. And again, lots of great data. The things that I'm most impressed with is the bottom half of this slide. So for each additional serving of fill in the food group, you can reduce your risk of death by the following percentages. I mean, look at legumes. That's beans, lentils, things like that. One serving, that's half a cup of beans a day. You can reduce your risk of death by 10%. And nuts, a serving of nuts is about an ounce. That's a handful. Half a serving of nuts a day, 15% drop in mortality. I mean, how easy is that? So more and more of this research is coming out. Every day I see headlines about studies on these various lifestyle factors and their ability to really have a big impact on our health and the health of our nation. So, we're starting to learn that maybe plant-based diet is a one-stop shop against chronic diseases. And so this is really important because of some of these trends that we're seeing in healthcare today. The bottom line is what all of this evidence is telling us is that all of those diseases back on that slide are not separate diseases. They all share like a fundamental root cause, and we can directly affect that. We can have a big impact on that by how we approach our practice of medicine and actually make that big difference that I wanted to make. And I'm sure all of you want to make going into healthcare, right? We're not going into healthcare just to be drug dealers and say, oh, here's your statins and whatever. We want to make a difference in our patients' lives, every single one of us. That root cause that I'm talking about is unfortunately our ultra-processed fast food culture, our culture that devalues things like sleep, stress management, right? Our fast-paced culture, the high rates of drug and alcohol use, that dependence that we have. even other addiction. Like, what about social media? So the reason I'm excited is the trends and the buzzwords that I'm starting to see cropping up a lot, not only in social media, but on like the healthcare email alerts from the various like American Medical Association, American Academy of Pediatrics, and what's going on even at the policy level. We're starting to see all of these buzzwords. I mean, you may have heard of things like digital detox and dopamine fasting. You know, these are things that are becoming more common. There's also this new concept of energy toxicity and how we look at how our diet is affecting us. So here's where I hope, if you haven't already taken biochemistry, pay attention in biochemistry. It's very important, right? Now, do I remember all the steps of the Krebs cycle and how many ATP are produced? Heck no. That like jumped out of my brain a long time ago, and I don't want it back. But what we know is when we take in too much energy, too many calories, and usually that's the processed carbs or the high fat foods, things like that. When we take in too many calories, it is actually overwhelming our mitochondria. They can only handle so much, and they get fatigued or they get sick, and they may even die off. And so that's that energy toxicity effect. And then the cell says, you know, I can't take anymore, closes the gates, and the insulin can't get the blood sugar into the cell. We have insulin resistance and we have type 2 diabetes, right? So this whole concept of energy toxicity is really making the rounds, and we're hearing a lot about it and learning how important it is. The other interesting, we're also seeing really cool things, at least I think it's cool, culinary medicine. Like you can be a doctor and then you can take some cooking classes and get like I don't know if it's full chef, I guess you could if you wanted to, but you can integrate that into your medical practice. You can do like cooking demonstrations and lessons and things like that and actually teach people how to do this. That's a whole field, culinary medicine, medically tailored meals, produce prescriptions, this whole food as medicine initiative. And that's the one that's gotten a lot of attention all the way up as far as the White House right now. They had a big meeting last year, a big conference, and they're really talking about ways that we can fund food as medicine initiatives in the primary care setting. So a lot of really exciting action going on right now. And I think the face of healthcare is really starting to shift, and it's amazing. So I'm just really optimistic about all of this. The other thing that you start seeing is some talk about switching from what's our current model of fee for service. That's where, you know, you do something, you get paid for it. You see a patient, you do a procedure, you know, you bill specifically for that service. And so the emphasis is on quantity, not quality, right? The more things you can do, like in primary care for us, it is a problem that we have to squeeze every patient appointment that we can into our schedule, because you get paid such a small amount per patient from the insurance company that, you know, for the business to stay afloat, you have to see as many patients as you can. Now, our group values time with the patients. So we might see like 20 to 25 patients a day each on average. I know of groups that are seeing 40 or 50 patients a day, and it's ridiculous. I don't know how you can practice medicine. So, you know, that whole burnout thing. So this fee for service model is it's not helping doctors and it's not helping patients. So we're starting to see something called value-based care, where your reimbursement comes more from the patient outcomes. You know, can you keep them healthy if they're sick? You know, can you get them healthy? So it's more on quality of care and less on quantity of care. So we're starting to see some dialogue about that and some shifts. And I think by the time you guys are in the healthcare system, it's going to be a different world completely. So that's great. So it's a big change. It is a big change. And smarter people than me are working it out. I am definitely not a policy person, but I know it's needed. So these trends really, it reflects this growing shift towards a more holistic preventative care approach, where you integrate these lifestyle factors that I'm talking about into a traditional medicine practice. It's super rewarding. And so I have one patient that I talk about who really was my sort of light bulb moment, where I thought, you know, what I've been doing this last 20 years isn't really working. You know, in my 15-minute appointment, telling patients and families like, hey, maybe you should eat more broccoli and less junk food. You know, it turns out it has very little effect. But I had this one guy, I'd been, you know, as he was growing up, I was following him and he was getting heavier and heavier. And by about age 14, He's markedly overweight and he comes to see me. He's not feeling so good. And I happened to check a blood sugar and it's over 400. He's got type 2 diabetes. So I referred him to the endocrinologist, as you do, and they took over his care. And I didn't see him much for a couple of years. He started all his medications. And so a couple of years later, he's about 16, comes in to see me for his checkup. And I walked in the room and I looked and was like, it took me a minute. Like, who is this kid? I don't even recognize this guy. Like, to link him back to who I had seen 2 years ago. He had lost a ton of weight. He'd been working out. He had muscles. And I was just floored. And I was like almost crying. And he's like, okay, my doctor's losing her mind. I was like, I just never see this. It's amazing. How did you do it? I was like, oh, I'm so proud of you. Anyway, so he went on and graduated and, now he's a grown up somewhere. So this was a little while ago, but it got me thinking, okay, it can be done. If he can do it, what about other patients? And what can I personally do different to help my other patients have similar results? So not too long after that is when I happened to stumble across lifestyle medicine, and it piqued my curiosity. And here I am studying for the board exam. There's one other area of growing research that I find personally very interesting and incredible. One other detail about me that I didn't share at the beginning is my undergraduate degree was in microbiology. So you guys might know where I'm going with this. Our understanding of the microbiome is just exploding. Just another example of how old I am. We didn't know any of this stuff when I was, mouth pipetting in the lab, which we did. And because most of these organisms, especially the gut organisms, they don't grow very well in a petri dish outside of the actual colon. We didn't even know they existed. You can't study something if you don't know it exists, right? So now we have, some of that shiny, sexy new technology, our ability to look at the genomes of all of these organisms, right? So I also stumbled across shotgun metagenomics. I was like, what's that? It's like the Wild West of biology. Why didn't we have that when I might not have gone to medical school. I might have stayed in the biology lab if we'd had shotgun metagenomics. I'm still not 100% sure what it is, but it's really cool. And it helps us understand or study all of the genomes in a sample, right? So you can take a poop sample and look at all the genomes and figure out like what organisms are in there and identify them. So now we've identified all these bacteria and other organisms that we didn't even know it existed before. And we can understand what their function is in our body. And we've just had such a huge growth of understanding. So, and how it impacts all of these different disorders. So the other thing I think you're going to be doing, instead of prescribing medication in a capsule, you might be prescribing crapsules. Have you heard of a fecal transplant? Do you know what that is, right? Taking poop out of a healthy donor. Dr. Deschner's great. I love him. So yeah, it's like the research just blows my mind. But even things like mental health issues, right? They've done case studies with severe refractory depression or bipolar disorder. And they've shown like dramatic improvements in these patients that had not had anything else help them with this fecal transplant. That's still, really emerging. Lots of more studies need to be done. But it's just all blowing my mind. When I talk about this stuff in the office with the kids, when I'm talking about nutrition, I tell them that they need to pretend that they have a little turtle that lives in their tummy. And if you've ever had a pet turtle, right, they like to eat leafy greens and berries. Well, bacteria eat the fiber, right? Anything with fiber. So animals don't have fiber, only plants. And we don't digest our fiber. The bacteria do. So if you can eat a lot of different types of whole plant-based foods with those intact fibers, you're going to feed your turtle and it's going to take care of you. So now, having said all of this, we have a long way to go. There's a lot that needs to change. And that's you guys. I'm looking at y'all. As these chronic disease rates continue to rise, as the burden on the healthcare professionals continues to rise, the cost of the treatments, think about the latest medication out there for obesity, the GLP-1 agonists, right? Lots of people are on them. They're very effective. They are crazy expensive. Surgical procedures, imaging, all these shiny, fancy new technologies that we have cost a lot of money, and it's not sustainable. I think that might be the one thing that really breaks our healthcare system is just how expensive it is. So the United States spends more on healthcare than any other developed world in the country, say that right, any other developed country in the world. And we have the poorest health outcomes. So we are spending a lot of money and gaining very little ground. So we have to have a shift, and it's coming, and I'm thrilled about it. Hopefully it'll get here before I retire, but I think we're seeing the shifts. And what we're seeing is established physicians like me who are taking an interest in this and starting to look at things like lifestyle medicine. And so I went to the American College of Lifestyle Medicine conference last year. And of course, it was a lot of primary care doctors, but there were obstetrician gynecologists there. There were radiologists, and not a small number of pharmacists. You think that would be the one field that would be harmed by this, right? But there is an interest and a role for lifestyle medicine, even at that level. So I just think we're just seeing this shift towards prevention, towards whole person care instead of that compartmentalized, organ, body system specific care. And the evidence-based lifestyle will be incorporated at some level into pretty much every specialty and every level of healthcare. That's it for me. I appreciate y'all letting me come, and I'm happy to answer any questions about lifestyle medicine, pediatrics, nutrition, whatever.
Be aware that this podcast provides general health information about nutrition and feeding of infants and children and is meant for educational purposes only. It's not intended to replace the important relationship between a parent, child, and pediatrician. If you have concerns about your child's nutrition, health, or growth, please consult your doctor.